Okay, so I did my presentation on muscle strength, muscle power, and muscle endurance. So two of the interventions that I used were blood flow restriction therapy, and I also chose aquatic therapy. So just a little bit about blood flow restriction, just what it is in general. It's resistance training while blood flow is being restricted by a pressurized cuff. So the costs. So I found that there's a lot of supplies that can be used. You don't have to use all of them. But some of the costs for the smart cuffs, arms and legs, 2 cuffs are $2.99. The full body set, which is 4 cuffs, is $3.99. The Smart Cuffs Pro, the standard set, is $9.99. The Elite set, which has 2 pumps, is $1,499. Just the Smart Cuffs pump is $249. The Smart Cuffs Pro pump is $599. The Smart Cuffs, the single cuff is $99, and then the Smart Cuffs pairs is $189. So equipment that is needed for this therapy are the cuffs, the pump, and preferably a training table. So, or just an area that they can use so they can perform this therapy. Training that I found a level 1 blood flow restriction class for students, which is, I found $249. So I found that the reimbursement rates were $20 for this therapy, and I found the CPT code for a 15-minute therapy, which is 97106. So I chose the outpatient tricep strain. So I chose this patient for this therapy because of they were still having some point tenderness. They still were not having full muscle strength. And this just happened about 5 days ago. This patient is a mother of 2, so she doesn't have a lot of time on her hands. And overall, I thought that this would be effective treatment for the patient. So in a systematic review, I found that the low load technique is more effective for helping increase muscle strength and endurance with the rehab process. And it's also proven that blood flow restriction decreases the workload to reach fatigue. So for policymakers and payers, the evidence supports that the use of blood flow restriction for therapy, it is cost efficient compared to aquatic therapy, which is the other intervention that I chose. This therapy can also help avoid future complications like a tricep tear or triceps tendonitis that would require additional therapy. They should consider reimbursement for blood flow restriction therapy. So for policymakers, this evidence supports the effectiveness of blood flow restriction for treatment of the tricep strain. Healthcare providers, including athletic trainers and physical therapists, can effectively help with this treatment for the tricep strain. By providing this treatment, it can help improve the strength without re-injury, reduce the workload needed to reach fatigue. These outcomes can also improve muscle strength, muscle endurance. They are low cost to the patient, which her husband is also unemployed, which is also why I chose this therapy. It's a little bit cheaper than aquatic therapy. And again, she's a mother of 2. So this intervention does not take long. And since she's a mother, she does not have a lot of time. And this intervention can help get the patient back to work. And she is a firefighter, so she does need her arm for that. So using this would be effective because it can help her increase that range of motion that she doesn't have. And it can also help increase that strength that she's going to need to fight those fires. So next I chose aquatic therapy. And just a rundown, this is a type of rehab that uses water to assist with movement. So I found a lot of supplies for this, and you don't have to use it all. But some of the supplies that I found were dumbbells, which is $23.99. The jog belt I found at $28. The kickboard I found at $11.99. The fins I found at $19.98. So equipment that is needed is the pool and some type of clothing that you want to wear in the pool, a swimsuit, workout clothes, whatever can work best for you. Some additional equipment that is optional, but it can help patients with therapy. I found the kickboard can be used, the jog belt can be used, the dumbbells can be used, and as well as the flippers. They can all help with therapy. So training that I found the aquatic therapy and rehabilitation certificate, and I found that the exam fee is $255. So I found the reimbursement rates at $30, and I found the CPT codes for a 15-minute therapy session, which is right there, 97113. So the patient that I chose for aquatic therapy was the secondary patient with the hamstring strain. This patient is in high school, and they are on the track team. So I chose this because they were still having some pain when they're walking. It's not as bad, but it's still there. They were also having radiating pain with one of the special tests, and her knee flexion is not all the way there for her manual muscle testing. So I found that the effectiveness for this can increase range of motion with the assistance of water. This patient can also increase their strength because they might not be able to lift their leg all the way. And this can also help with gait training if needed. And it can also help improve muscle endurance. One of the systematic reviews that I found showed that moderate evidence for aquatic therapy helps with pain and functional mobility for lower extremity injuries, which is what this patient is. She needs help with pain and she needs help with getting her muscle strength back for track. So for policymakers and payers, this evidence supports the use of aquatic therapy for treatment. This is cost effective for this patient. And to give you a background about this patient, her mother is a single mother. She is a physician, so this should be a cost effective for the patient. This can help avoid future injuries like a hamstring tear or hamstring tendonitis that would definitely need more therapy. So aquatic therapy should be considered, and they should consider getting a reimbursement for this. For policymakers, this evidence shows the effectiveness for aquatic therapy for the treatment of hamstring strain. Athletic trainers and physical therapists are healthcare providers who can help with the effective treatment for hamstring strain because of the current education. By providing this treatment, this high schooler can help improve their strength, which they are weak on. They can help improve their knee flexion to get back to track. And hopefully, this should help with the radiating pain since she's not putting all of her weight on her legs while she's in the water. So this should also help with that type of pain. The outcomes are the improvement of strength, also muscle endurance, and that increased knee flexion for the manual muscle testing that is a little bit weaker. This intervention is cost effective, like I said, for the athlete and their mother. And this patient is currently just in track that we know of. So this can be effective for helping her get back to track. So the other patient that I chose for aquatic therapy was the college student with the rotator cuff strain. So I chose this treatment for this athlete because they are about 4 days post-strain. They're still having limited range of motion, and their manual muscle testing for abduction was slightly less than what it needs to be. And so that says that their strength is decreased, which this therapy can help with. And this can help with the increase of range of motion because of the assistance of water. It can help increase their strength, which is what they need to get back to tennis. And this helps restore function by restoring motion. In a randomized control trial control study that I found, it was stated that aquatic therapy can help with the improvement of muscle function and strength compared to dry land therapy that was used after rotator cuff repair. So for policymakers and payers, for payers, the evidence shows that aquatic therapy should be used for this treatment. This treatment is cost effective for this patient. And to give you a background on this patient's for cost, their mother is a school teacher and their father is an accountant. So this should be a cost-effective treatment for this patient. This can also help avoid future complications like a rotator cuff tear or rotator cuff bursitis or tendonitis or even shoulder impingement. And this would definitely require more therapy, which they're a tennis player and they're a college athlete. They're not going to want to have to get more treatment. So they should consider reimbursement for aquatic therapy because the evidence shows that it helps. So for policymakers, the evidence supports that there is an effectiveness for aquatic therapy for rotator cuff strain. So some healthcare providers that are able to help with this treatment are athletic trainers and physical therapists because of the current education. And by providing this treatment, this college athlete can help improve their strength, their active range of motion, their endurance, and their pain as well, in order to get back to tennis. These outcomes result in improved strength, improved endurance, and improved active range of motion. This intervention is cost effective for the athlete and their parents. And this patient is just in tennis right now. So physical therapy or for aquatic therapy should be effective to help them get back to their sport. And that is my references. Thanks for listening.